I think this is less about poll. I'm not saying that's completely out of it, but more about personal philosophies, and that brings the full circle back around why you have to be so careful the coalitions you build, because some of these coalitions are on the side where you're going to move into philosophical grounds where some of the lawmakers are going to say, I can't go there, I'm sorry. Sometimes just because of promises that have been made to their constituents. So that's why I think it's so important that you focus this on science and alleviation of human suffering. And that way you don't get into that ground of controversy and philosophy, because if we, most of us still, I know you get frustrated as heck with politicians, most of us still, if we made a promise to our constituents and we made it publicly remembered, you got to make sure and focus on that. I mean, what did you lobbied up there a lot? What were the more mainstream legislators telling you?
What does the pharmacy board say about it?
Okay, yep, and that's...
Which you actually said to me 2 years ago,
yep,
when I first started talking to you. You said, what do the medical societies say? So I think you're right. We need to keep the focus on medical organizations.
And I went from a no to a let's continue the discussion, and it's happened in one way, and I guess this is how it's supposed to work. It's because my folks are talking to me, and I've got people talking to me that would be the last folks. I mean, I would never predict that they would be telling me to look at it. And so if I'm going to ask the question, we better listen. And so I think just if you've got poll numbers like that, and you've got folks like this that are hurting, I don't think you should be afraid to encourage us not only to continue to have the discussion, but encourage us to go out and talk to our people. Because that's what's that's what moves us still. We're still small enough in the state that people talking to us, you can change our minds. And that, I mean, I know we're frustrating as heck up there. You can get us, you can get politicians. I went from a no to continue the discussion. So and I've said it in multiple public venues. And so I feel very confident, because believe me, I hear about it. If I had folks that were, so I feel fairly comfortable about saying that to people. But I didn't mean to take all this. But
no, this is good.
I know you're late to it. That was my medicine time.
That's all right. I actually have a flooding issue in Atalissa.
Yeah, I'm just curious about the relationship between Big Pharma and the Board of Pharmacy. I mean, just like you look at the lobby list for the legislation, just all these drug companies, they can't patent this, so obviously they'd have an interest in preventing medical marijuana from moving forward. So I don't know, what are your thoughts on that?
Yeah, I mean, they're appointed by the governor, which is one issue, since the governor doesn't support it. And then the other issue is they're a bunch of pharmacists. It's kind of like asking Pepsi and Coke if they would support a pop tax and letting them make the decision.
Yeah.
You know, but Raphael Mechoulam, the Israeli researcher, he believes that marijuana could replace 20% of the prescription market.
Obviously, pharmaceutical does not want to do this.
Oh, yeah.
It's big money.
Right.
Who's going to lose the money?
Mm-hmm. And what we have right now is Marinol, which, like I said, isn't as effective. It takes an hour and a half to go into effect. It's only one of 80 medical compounds in marijuana, and it costs $700 to $1,000 a month. So the question to me as a conservative is how many people are on disability that the taxpayer is paying $700 to $1,000 a month that they wouldn't be paying for this, because there's only one state who has allowed you to pay for it with disability. And I don't see that happening in Iowa.
What state is that?
I think it's Oregon.
You're saying if you get on this disability, you probably wouldn't have a chance to get medical marijuana.
No, you can still get it. It's just the taxpayer wouldn't be paying for it.
Well, I'm probably going to get on it anyway, but I don't even know if I have enough money even left, because I have no unemployment, and I'm having to do job searches and all kinds of stuff. I have no home computer.
I like the one thing in the bill they had, though, for some of us patients. Like, I live on 2.5 acres. I don't have neighbors. I mean, we're out in the middle of nowhere. I do not have a problem growing for somebody who can't. And that's one thing I liked about the bill.
Mm-hmm.
That I wouldn't have to rely on any money going out.
Mm-hmm.
I mean, seriously, to grow a pot plant will just cost you nothing.
Right. And here's the other issue. What some states have done is you can have 2 dispensaries in the state, and you can't grow your own. So if 2 businesses, and our bill is also nonprofit dispensaries, which is helpful. But if we restrict the market to only 2 businesses in the entire state, they can charge whatever they want.
Exactly.
You know, it can be $60 a gram.
Just like California.
Right, right. And so I'm concerned about limiting the dispensaries, and with a rural area like Iowa, and since they're nonprofit dispensaries, I think we do need to look into having the ability to grow your own medicine where it would be no cost to you instead of having to go out and pay all this money. But the bill also has protections for that, and if you sell pharmaceuticals that you are prescribed, that's a big crime. And if you're a medical marijuana patient who is diverting marijuana that you grew for yourself, that's a crime, and that's something that we need to prevent. And so if, like you talked about with increased penalties, maybe that's where the increased penalties should be, is if you are somebody with a medical marijuana card and are really just growing marijuana to be a drug dealer, then that's where the increased penalties could lie.
Yeah, and I was just thinking out loud when I said that. I get a little nervous when I hear about growing your own, because that would be I would imagine, a law enforcement nightmare.
Well, with having a state-issued medical marijuana card, if you pull somebody over, they have marijuana, or you somehow find that they have marijuana, it's simple enough of finding out if they have the card or not.
What did Michigan do?
Michigan has medical marijuana cards, and they have grow your own as well.
And that's the one that passed the referendum.
63%. Yeah.
I've got a 5-year-old friend that lives there, and she's starting to grow her own. She didn't know anything about it. And I tried to explain to her, I said, well, you have to pick your right strain. I said, there's huge amounts of strains. You need to, I talked to her about that stuff. So yeah, she's never really used it before. So she's pretty excited.
Yeah. Yeah, and like you said with strains, there's lots of different marijuana strains where some are high in THC, some are high in cannabidiol, which helps with anxiety, some are better for pain, some are better for nausea and stuff like that. So it's just putting it into a pill is kind of hard because you can't target it as well. So it's important that they have the options of multiple strains or whatever that they find works for them.
Don't forget to show up in forums too, and pin the candidates down as to where they're at.
Yeah, not just these forums, especially the legislative forums that are going on with the campaigns. So, all right, thanks a lot, Jeff. Thank you.
Thank you.
Jeff, thanks a lot for coming.
Nice to meet you.
Well, does anybody have any other comments or questions about the bill? Or?
No, just thank you for doing what you're doing. You're doing a good job.
Well, you guys are doing great being here too. Writing letters to the editor is something I really suggest, but really the most important thing you can do is, like Jeff said, is to contact legislators, not just your own. One of the main things they ask is where are you from, because if you're not from their district, then you're not as important. It's just common sense. But you can also target the leaders in the House and the Senate. If you go to my website on Iowa Patients, I have a list of who's on the committee that would have to approve it, and also who's in the leadership that decides the task force and the committees. And so, if you want to contact the Board of Pharmacy, I mean, they know it's medicine. They need to hear from the patients that we're being let down by them. So. Well, does anybody have any other questions or comments? If not, you can stick around. I have a 75-minute award-winning documentary, Waiting to Inhale. You're more than welcome to watch it. If not, I'll step outside, and if anybody wants to talk to me during the